Hello, welcome to my little talk on osteoporosis. I wanted to do this video and I will be doing more down the track on different diseases and injuries and things like that, just because I want people to be aware of why exercise is actually good for you and it's not something to actually be afraid of. Now, I am just going to do a disclaimer quickly and just say that this is essentially something that everything that I've learned has been through my studies at university, through watching people, working with people, and everything like that. However, please make sure anything that I say in this PowerPoint presentation, in this video, if you need to see somebody such as a doctor or an exercise physiologist, an exercise physiotherapist, I would highly, highly, highly recommend seeing somebody before you actually start any kind of physical activity if you feel as if you may possibly have osteoporosis. So, what actually is osteoporosis? So osteoporosis is a condition where bone strength becomes quite brittle and can easily break. So I think of osteoporosis as a visual, like a sponge. Okay, so it essentially is quite porous and it is quite spongy. So it affects the wrists, the spine, and also the hips the most. So essentially, what can happen with people with osteoporosis, and I have actually seen this, is if you have a fall, then you can easily break a bone. So, and those three, the spine, wrists, and hips, are the most prominent in actually getting broken. However, it can happen in the sternum, it can happen in legs. It really just depends on how you also fall. And another really common one that I hear is actually when you roll over in bed, you can break your wrist, you can break a rib. So it's really, really, really important, essentially, to make sure that we keep our bones really strong. And this is, I'm not talking to you as a somebody who already actually has osteoporosis, because you would already know about this. I'm talking to people who essentially as a preventative measure. So on the outside of the bone, it actually does look normal. So if you had literally a limb sitting in front of you, it was a bone, the outside of the bone looks normal. However, as you can see in the picture, it becomes extremely spongy and it becomes quite holy. So there's quite a lot of larger holes in it, and that's essentially where the bone density hasn't come back. So what causes osteoporosis? So it's essentially the composition of which bone mass declines quicker than it can be regenerated. So we have osteoblasts, osteocytes, and osteoclasts, essentially that make up the physiology within our anatomy and physiology human body. So osteoblast is actually the building blocks of creating new bone. The osteoclast is essentially when you have old bone that needs to be broken down, and osteocytes is it works with the osteoblast. So essentially, when there's new bone, that bone hardens. So that's what becomes a mature bone cell. Okay, so the osteoblast becomes osteocytes, and then the osteoclasts kind of come in and take away the osteocytes out of the bone and get replaced with new bone, which is the osteoblast. So osteoporosis actually affects 200 million people worldwide, 1/3 of postmenopausal women, and that actually can climb a little bit as well, depending on your situation. So if you have had cancer in the past, or if you have another diagnosis of another disease, such as MS, then essentially you're actually at a higher risk of developing osteoporosis, just for the fact that uh, your bones just won't get the strength that they need, and it's really, really important to being able to continue exercising, even though you do have these conditions or diseases, especially with cancer and things like that, because of all of the chemotherapy and the radiation that people go through, then essentially it can break down bone quite quickly. So 20 to 25% of the male population can actually develop osteoporosis as well and get fractures. And in the growing population of the elderly, so essentially when at the age of 50, that's when our bone starts to really decrease. And at the age of 30 is when it's actually at our peak. So that's, for me, really, really an important and vital piece of information to know, because you can have really, really strong bones and really strong muscles, even at the age of 29, 30, 31, but then essentially that's when it starts to decrease. And that's when it's at the most important and pivotal time to really start exercising and training. Even if you don't feel as if you're unfit or anything like that, it's just really important just for quality of life later on in life. And because of the age of 50, that's essentially when we start to hit menopause as females. And with menopause, it changes our human structure inside the body. So there's a lot of hormonal stuff going on. And as soon as you hit postmenopausal, and that's essentially when you're osteoporosis, or when you're most susceptible to osteoporosis. And if you've had postmenopause because of a cancer or something like that, then again, that's something that you really need to be aware of and careful of, is making sure that you keep your bones nice and strong. So essentially, in the picture, I've got normal bone and osteoporosis bone. You can just see the difference in how the bone has developed. So there's a lot more bone development in normal bone than there is obviously in the osteoporosis. So as I mentioned before, there's just it's a bit holy. So essentially, bone health is the balance of bone deposition and reabsorption. So what that kind of means is it really, our hormones and our parathyroid glands, or PTH, essentially comes into play when we are building new bone. So calcium is made in the parathyroid gland, and it's really important basically to have the makeup of bone. And what happens is, if we're not getting enough calcium, the PTH will actually send new calcium out into the bloodstream and go into the bone and help create new bone. So it's actually super cool how the body actually works. The body is an incredible structure. It's definitely one where you learn one thing and it's just a rabbit hole for something else that you wanna learn. So yeah, it just filters through the blood basically, and it will either create more or it will create less calcium in the body, depending on what the bone needs. However, if you already have a thyroidism, a hypothyroidism, or any kind of, if you don't have thyroid, then again, that's really something that you need to be aware of when it comes to osteoporosis. So there are so many causes of osteoporosis, and it really isn't just one thing. It's a lot of different things. So if you have been anorexic in the past, bulimic, there's actually intense athletes. So athletes can also get osteoporosis because of muscle wastage, especially if they train really, really hard. As I mentioned before, cancer, so radiation therapy and chemotherapy, can actually cause muscle breakdown and bone breakdown as well. So, and as I mentioned before as well, if we don't have calcium levels and phosphorus levels, then essentially it changes the structure of the bone. So we need to exercise basically to be able to build our muscle and our bones. If we don't exercise, we actually lose 1.5% of our muscle structure per day. How that blows my mind. So I don't know if it blows yours, but it definitely blows mine. Smoking, so that's not a new one to people. Smoking obviously has a lot of side effects to the body. So ideally, you want to make sure that you're not smoking. Low sun exposure, low calcium, apoptosis, that essentially just means the death of a cell, any kind of substances, and also stress. Stress is a really, really big one because stress releases different types of hormones in the body, and our body doesn't actually like to be under too much stress for too quickly. So we've got fight or flight situations, but that is essentially a whole other topic for another day. So osteoporosis has a wide range of presentations. So you can get loss of height, you can get back pain, fractures, as I mentioned, in the hip, spine, and the wrist. And you can get kyphosis as well. So kyphosis is actually a curvature in the spine, so at the top. And asymptomatic essentially means that there is actually no symptoms whatsoever. So that could be when you roll over in bed, you've suddenly broken your wrist, or you've fallen over, you've broken a hip, and that's actually when you find out that you could have osteoporosis. And that happens quite a bit as well. So the effects on osteoporosis and exercise, essentially, we just need to make sure that we're really careful when we exercise and you're in the right hands, making sure that you have help as well, because you just don't want to do anything that's going to actually hinder you. You want to do things that are actually going to help you. So this includes essentially resistance training. You want to avoid too much twisting, bending too quickly, high impact activities, and you really, really want to stick to resistance, low to moderate impact activities. So it does have so many benefits to skeletal and muscular health and essentially creating a better overall well-being. So why do we resistance train? Why do we lift weights? And lifting weights, as a female, I don't want to be bulky. Lifting weights as a female does not do that. Okay, so right now, shutting it down, it does not make you bulky. We do not have the testosterone in our body for that to happen. So Wolff Laws states it is a biological phenomenon that bone hypertrophies in response to bone loading, and thus the normal response to gradually progressive exercise is for bone strength to increase. So hypertrophies essentially just means the enlargement of an organ, a tissue, cells in the body, and they get larger and they get stronger and they just increase in size. And that's essentially what you want to achieve when you're lifting resistance or weights and building strength for osteoporosis and many other things other than osteoporosis. But because that's the topic, that's what I'm going to go with. So the ACSM, so the American College Sports Medicine Guidelines, is essentially you want aerobic activity for roughly 150 minutes a week. Okay, so 2 to 3 times a week, and resistance training 2 to 3 days per week as well at 60 to 80% of 1 RM. So 1 RM just means 1 rep max, and I'll go through that in the next slide. So this is to increase bone density or at least maintain. Losing is not really something that we want to do. So we definitely want to either increase or at the very minimum, maintain what you have left. So there's, depending on the type of osteoporosis you have, there are different types. So you can get osteopenia, which is the start of osteoporosis. So you're not quite at that higher level yet. But depending on what level you're at, these are some of the recommendations for exercise. And this is the most up-to-date version at the moment for exercise for essentially anyone with osteoporosis. So, for example, aerobic, you want to use large muscle groups. So you want to go for walks, you want to do some swimming, and you want to do activities such as gardening or cycling or just housework to keep everything going. Strength, you want to make sure that everything is on the floor, so not any kind of high impact work, so no jumping, no running, that type of thing. And you want to make sure that the weights that you're lifting are going to actually help in everyday life. So opening a jar, for example, something that's you're taking down from the shelf that's above your head, being able to sit and stand. So just very basic activities for everyday life, but it's going to help you keep quality of life. You want to be flexible, so you want to make sure that those muscles stay nice and flexible, especially around the hips, the shoulders, the back, the neck, all of that type of thing, because being flexible just means that you have better range of motion, better balance, things like that. And you also always want to warm up and cool down before you go into your full programs. So if you've probably been having a look at the frequency, duration, intensity, and progression of all of those while I've been talking. So essentially, you want to kind of pretty much stick to around with your strength training, 8 to 12 reps is usually pretty good. And ROM means range of motion, and 1 RM, as I mentioned, is 1 repetition max of what you would lift as one rep. So you only want to actually be working at around 50 to 70% of your 1 RM. So nothing too heavy that you're going to get tired too quickly. We want to be able to build the muscle as a hypertrophy muscle, not a strength muscle. Okay, great to have strength, but we want mass as well. So the earlier you can start exercising, the better. So if an individual actually has severe osteoporosis, then essentially you should seek medical attention from GPs, physios, pretty much anyone who specializes in osteoporosis. So the situation is difficult as their bones can benefit from exercise. They definitely can. However, you just have to make sure that you know what you're doing and you are under the guidance of a professional. Exercise should be instituted quite quickly after you get diagnosed, but as I said at the beginning, this is actually something for me to be able to keep people aware as a preventative measure, not something that is a cure. So essentially, what I've gone through is what osteoporosis actually is, how you get osteoporosis, and the exercise recommendations for when you actually have osteoporosis and osteopenia. However, as I mentioned, and I can't stress this enough, is the fact that everything that I talk about is not as a cure, it's as a preventative measure. So the earlier you can get started in exercising, the earlier you can start eating properly, the earlier you can start staying away from substances, smoking, things like that, the better chance you're going to have by not developing osteoporosis later on in life. So you want to be able to have a balanced diet. You want to be able to have an exercise regime that you can keep up for the rest of your life. Be kind to your body. It is actually the only one that you have, and you have to keep it for 70 plus years. It's a long time. Okay, so try not to abuse your body to the extent where later on in life you have regrets about what you've actually done earlier on in life. And you want to practice balance. So balancing is really, really helpful to prevent falls. And preventing falls essentially for somebody that does have osteoporosis is it can be the make or break. All right. So as I mentioned before, just as the last bit of disclaimer, please seek medical attention if you feel as if you may have osteoporosis, or if you want to start an exercise program with somebody specifically that specializes in osteoporosis, or you want some guidance. However, I would really suggest at least seeing a medical professional prior to starting any kind of exercise programming. Thank you so much for making it all the way to the end of this, and I look forward to sending you another one. Bye, guys.